Now, why are we talking about land within the context of housing? Housing accounts for more than 70% of land use in most cities, and yet more than 1 billion people in cities around the world still lack secure land rights. Now, looking at this from a gender perspective, we know that women are about half the world population, and yet it is estimated that less than 15% of landholders are women. Now, the main reason why we have such few women, again, who are landholders, it's because women always continue to face many legal and social barriers that limit their ability to access, use, and benefit from the land. And at the same time, we noticed that during this COVID times, various vulnerabilities are enhanced during this period. And we see that there's a potential that even these gains that has been made around women's land rights could potentially be rolled back during the COVID pandemic. And this is just building on lessons that we have seen in previous pandemics, for example, like in the case of HIV/AIDS. Now, so within the context of secure tenure rights, one of the things that we know that without secure tenure, then people often do not have confidence to invest in their land, because then they know that the investment cannot be long-term. So that is why it is important to have secure tenure rights for all, including for women, because again, once you have that secure tenure, then you're more likely to invest in a decent home, such that then you can safely shelter in place during times like this, when we are required to do so as during the pandemic. Now, as we try to understand the issue, different areas that affect women's land rights and housing, we normally look at the formal system that is put in place by governments in terms of the legal framework or the institutional framework. And then also we look at the status of women within the domestic unit, that is at that household level. And then also issues around the economy and education. For example, we find that if you don't have secure access to land and you don't have a legal documentation to prove your rights to that land, it is often not easy to get credit from financial institutions, for example, because you cannot prove that you have collateral. And then the other thing that also really affects women's land rights is custom or religion. Now, we find that customary practices in many parts of the global south vest power in male members of the family as opposed to the female members. And they often, in many cases, favor men or boys compared to girls. And again, in most of these countries, you find that inheritance is the main role through which land is transferred from generation to generation. And oftentimes, this is skewed towards sons as opposed to daughters. And in many cases also you find if these traditional norms conflict with the formal system that is within the country, then often the local norms generally prevail because they are normally enforced at community level. And sometimes it is not practical or it is difficult for governments to really go down to that level to ensure that those their laws are enforced. And that's why oftentimes you see that you may have a legal framework, you have those kind of safeguards in law. But again, when the custom is very strong, then again, a lot of work really needs to be done at the community level to ensure that there's some sort of acceptance. Now, just looking at past pandemics, for example, the HIV/AIDS, for example, and looking at trying to see how this can be a vicious cycle potentially during the COVID times, we know that women continue to lack secure property rights, and this dispossession always affects them in different ways, especially when the husband dies. During the times of HIV/AIDS, for example, and also something that we're seeing right now, we have seen a lot of stigma around HIV, and even now during COVID. And there's always the perception that if you got HIV/AIDS, or now if you get pandemic, then somebody would die. Now, in the cases where a husband dies, then sometimes this can put their wives at risk, because there have been already reported cases of widows who have been dispossessed of their land, or widows who are being kind of forced to sell their land after their husband dies. So again, if this happens, then of course there'll be problems of increased landlessness and also more vulnerabilities. They may not have a place to stay, and this again will increase the spread of these viruses. And again, the vicious cycle continues, because then more and more people will continue to have the virus and so on, and then the vicious cycle continues. Now, how can we work to address this vicious cycle? Now, one of the things we need to recognize is that women are not homogeneous, and we must really look at the complexity of the women's lived experiences and the different factors that determine how their relationship to that land, for example. So that in order, as we are designing any interventions and so that we can really achieve real impact, we need to look at the particular situations faced by particular groups of women in particular locations, because then with regards to their land rights, because then if we don't do that and then we sort of come up with a one-size-fits-all kind of intervention, then that may not work because of the different nuances that we see towards the progress around how we can address the issues around women's land rights. Now, as we do this, then we have to really identify what are the kind of underlying relationships or barriers or layers of vulnerabilities that women encounter, which are often shaped by factors such as religion, caste, ethnicity, marital status, age, and etc. Because again, looking at the different factors, you find that different ones actually present vulnerabilities in different ways. Now, looking at what Habitat for Humanity has been doing to break this vicious cycle, Habitat continues to advocate for norms, policies, and practices that increase access to land for shelter for all. And as part of this, Habitat in 2016 March launched the Solid Ground Global Advocacy Campaign aimed at increasing access to land for shelter. And to date, through this campaign, access to land has been increased for more than 3 million people around the world. And one of the themes under the Solid Ground campaign is gender equality, which really was really recognizing the disparity that women face with regards to land rights, and really working to ensure that women benefit from the land as much as their male counterparts. Now, as part of a Solid Ground, we have implemented this in various countries around the world. In the Asia Pacific region, one of the countries is in Nepal. This picture that you're seeing here is one of a member of a family that we have supported in Nepal, and this is the kind of home that she was living in before. Many of you might know, remember that in 2015, there was one of the worst earthquakes in Nepal. And many of the people who were affected were the most vulnerable. And in Nepal, we're working with the Dalits. The Dalits in Nepal, they have the caste system. So this is really the lower caste in the community. So apart from the women having to deal with caste issues, then they also have to deal with gender issues with regard to access to their land. So many of these families that we came across, they could not benefit from reconstruction assistance because they could not prove their ownership of the land. So as part of this, our work in Habitat in Nepal, Habitat worked with these communities to navigate through the process of securing their tenure in terms of getting land titles. And one of the things that we have really been promoting and have been working toward is ensuring joint titling of the land, so that for every title, then the name of both the husband and wife are in the title. And this is in a way to try and ensure that we protect the rights of both the husband and the wife, irrespective of whether they are still alive or not. Apart from Nepal, we've also done the same in India, where we are working with Irula communities. Irula is also one of the scheduled tribes, or one of the lower caste tribes. Also the same thing they have been experiencing. So we have done the same and worked with the communities to ensure that there's joint titling, and then they can really be able to invest in their land, and we can work with them. And as part of that, both in both Nepal and in India, we have worked with them, and we have partnered with these families and to build homes which are now able to withstand any shocks, for example, even if it is an earthquake or flooding and so on. But at the same time, these families are also able to safely shelter in place during the COVID-19 times. Now, looking ahead, I think as we think of how to build back a better world after the pandemic, it is important that we strengthen our housing, land, and property rights for all. And looking at this from the gender perspective, I think it will really be important for governments to put in place, to implement broad protective measures that ensure that no one loses their home during this pandemic, because again, this will help make them more exposed to the virus. So we protect them from issues like disinheritance, eviction, or foreclosure. At the same time, we also need to work with local leaders and community level actors, since normally the strongest resistance to women's land rights are often found at the community level. So again, if we do not engage with the communities, then we might not be successful in dealing with this issue. But in the longer term, it is important to reform inheritance laws and marital property regimes, because we often find that sometimes you have land laws that support women's land rights, but these are in many cases undermined by other laws such as family laws or inheritance laws, which then do the opposite. So somehow there's a disconnect between the laws, the land laws, and then there's a disconnect with what is provided for in inheritance laws. So I think we need to really see how all this can work towards a similar goal. So that's the end of my presentation. Thank you very much for your attention, and please feel free to any reactions. I'll be happy to receive any reactions from your end.
Thank you so very much, Rebecca. That was wonderful. And I'm sure that her presentation sparked many questions, comments in all of your minds. And so as you have those questions or comments, feel free to use the Q&A function. If for any reason you can't quite get that to work, then our chat box is open, and we'll be saving time at the end of the two remaining presentations to engage in conversation. Thanks again, Rebecca. I'm so delighted now to introduce my colleague here at Purdue, Dr. Masibo Lumala. He is a senior lecturer at the School of Information Sciences at Moi University in Kenya, and we're privileged to have him as a visiting professor here at Purdue in the Brian Lamb School of Communication. Dr. Masibo has published widely in the areas of gender, media, communication, and culture, and has been thinking quite a lot about issues of housing and health, which he also has experience with in the Global South. Before his current academic career, he was the director for the Kenya Tourism Research Institute. Dr. Masibo, the floor is yours.
Thank you very much, Stacey, and thank you for your very kind introduction. I wish to quickly talk about one subject area that is interesting, because as far as I'm concerned, it is still very live, and I do not know whether to refer to it in the past tense or in the future tense. I'm not so sure. But I'm going to talk about the aspect of some reflections on the stay-at-home orders during the COVID-19 pandemic. I'm focusing on the Global South, but really I'll use most examples will come from Kenya, probably Uganda, Tanzania, and the East African region as a whole. The Global South section is what I highlight there, right from the Latin America, going through Africa and Southeast Asia. Probably they have very common characteristics, but one key aspect of them is that most of them are developing nations. Now, following the declaration of COVID-19 as a global health pandemic by the World Health Organization earlier this year, we ended up having a number of measures put in place to help control the spread of the coronavirus. And one of them was stay at home unless you are an essential worker. And I know most of us right now are following this probably from the comfort of our homes. We were told to wash your hands with soap, avoid close contact, cover your mouth and nose with a mask, cover coughs and sneezes, and monitor your health daily while at home. So we were expected to be alert in case we have any symptoms. But my presentation focuses mostly on the whole concept of staying at home. Why? Because this particular concept presupposes that everyone has a home. And so the question that we may be asking ourselves is, what sort of home did people find themselves in as this declaration was made? When we were asked to stay at home, were the homes uniform? What about people who are living in camps like refugees? Are tents also homes? What about the homeless, those who have nowhere to go? How do you deal with such situations during a pandemic? And so the question that I'm asking, when you say which home, let's contrast those two. The picture on the left and the other one on the right. Both of them are homes, but you can see that there is a very significant difference in terms of what those two homes can offer during a pandemic. Indeed, In Kenya, there has been talk about race against time as the rich Kenyans install ICU beds in their homes. And so you are imagining here, you are living in that slum house or in that semi-permanent structure in the rural area, but there is somebody else who is installing a whole ICU in their home. A big difference in terms of what stay at home means. Because for one, you will stay at home and die, and the other one can stay at home and be able to be exposed. So the very purpose of these orders is, one, to limit exposure to the virus, and if sick, prevent exposure. Now, this is one of those things that I found most paradoxical, as one of the photos will be highlighting, because you're talking about staying at home when you are sick. In ordinary times, when someone is sick, you expect them to go to hospital. But on this occasion, we were told when you are sick, stay at home. And only essential workers were allowed out of their homes during these orders. When the orders are executed, only essential workers. And again, ladies and gentlemen, most of us may now appreciate that we have just come to discover that some of us are either essential workers or we are non-essential workers, depending on whether we are supposed to stay at home or we are supposed to go to work. We were to cut back on usual activities that require people coming together in large numbers. And normally you will go out, you have parties, you have picnics, you have weddings, all this was stopped. And we avoided public venues such as cinema, swimming pools, and sports during these orders when they were put in place. So stay at home if you're sick, and stay at home to save lives. And this is the message that I was saying. It sounds very paradoxical, and we have the essential workers. Now, during these orders, most of us will now appreciate that we have really converted our homes into many things. And our homes first and foremost became hospital wards. Why? Because when someone was sick, we were told you are not supposed to leave home. And especially if anyone remembers, I remember Chris Cuomo for CNN. When his wife was unwell, Chris Cuomo migrated to the basement. And when he himself ended up being COVID-19 positive, again, he found himself having to isolate. And so a home required some room where you will isolate yourself and even have your own bathroom. The other thing was that all schools closed around the world, except of course a few countries where maybe the pandemic has slowed down and so schools are resumed. And so our homes, we had to make room for classrooms for our children. We've converted our homes into offices. We have used our homes as churches. In fact, I think most churches went online, and I could see adverts saying, going to church is not just a building, you can pray from anywhere. We have exercised from the comfort of our living rooms. We have learned how to cook because restaurants were closed. So we had to really take out our recipes and practice a number of things. And of course, we have danced and all that. Having done all those things in our homes, then the question, of course, we did them because we wanted to address certain challenges. You want to avoid the boredom that comes with just staying at home and doing nothing. You're not going to work. Now, some of the effects that I have isolated, and I think here I would like the attendees to be able to share some of their experiences as they stayed at home in the chat room. Because I found that, of course, the first positive effect is that staying at home guaranteed us safety from the virus. And that we have had situations where, reading from the newspapers and social media, families have spent more time together. In fact, some of them were even heard saying, oh, we wish this lockdown can extend a bit because we are spending more time together as spouses and husbands and wives, and the children feel like they have got more attention from their parents than they have ever gotten before, because most of the time they stayed with teachers. We have learned new skills during this period of the pandemic, and of course, for some, it has been offered as an opportunity to rest. But then what are some of the flip side of staying at home? we have had, I think, a terrible experience when we have lost our loved ones during this period, because our normal cultural practices of even paying our last respects to the dead have been completely controverted, and we do not seem to have a way out of that. Then because the lockdowns and the orders of stay at home came so abruptly, we have had many missed opportunities. If you had planned a trip, if you had planned a research, you had planned to do anything, all these things came to an abrupt end. We've had unemployment, very high level of unemployment, increased cost of living because you are staying at home now. The cost of electricity has gone up if you use electricity. We have had inflation where we have food has not been available, and we have seen long queues of people looking for food. For some people, because of loss of jobs, they have been unable to even pay rent. And now I want you to notice a significant difference between the global south and the north, because you might find that in countries where we have social welfare, people have been given some rebates and people have been given financial support, but this has not happened in most of the developing nations. Increased stress, anxiety, insomnia, all these things are things we have experienced because of you will never know, especially when you hear your loved one is now COVID-19 positive, the anxiety will obviously set in and you will never know where next. Then we have had an increase in cases of domestic violence. We've seen people who have had to even kill their own children in some countries. Others have taken their own lives on account of their inability to provide because they are staying at home and there's no food. And then, of course, loneliness. The person speaking has experienced that when you are stay-at-home orders find you far away from your own family. You find yourself in a lot of problems, and there has been generally an increase in crime. So you come back home and your house is locked. How do you stay at home? Yet you can't be able to pay rent. This is a family in Uganda, and they have been evicted right in the middle of the pandemic, and it becomes very difficult for this family to exercise the very things that they are saying, the order of staying at home. As a result of these orders, most people have skipped going to hospital, and a number of children have missed vaccinations in different countries. Indeed, hospitals reported very low cases of other ailments, people going there in case of any other form of sickness. We've had teenage pregnancy reported in some parts. Of course, this has not been verified fully as attributable to the stay-at-home orders, but the very fact that schools have closed has contributed largely to the increased numbers of teenage pregnancy. Now, looking ahead, then I think we have to really think in the context of what we are discussing here, that when you are thinking about public health advisories during a pandemic, it's important that we take into account the differences that exist between different countries. I do not think, like the previous presenter pointed out, you can't be able to just set out a uniform set of rules and policies to apply to every situation. So we need to think about the variations in socioeconomic realities, and so the one-size-fits-all is fairly unrealistic from the World Health Organization. Let's think about access to proper housing as an important aspect, and in fact, we need to think. I remember in our webinar number 2, one of the presenters, Dr. Stacey Connington, he argued that there's need to declare housing a human right by the UN, and then governments will be made to ensure every home has access to clean water. Because you can't be talking about wash your hands when the very homes you are staying in do not have water. Then let's, at personal level, I think if we're going to build houses, we must think about where, what, why, when, and how. Because from a very disaster point of view, we have seen some people who have lost their homes during this pandemic to floods. The irony of it that these are perennial occurrences. Every year you have floods and people lose their homes and they are relocated. When the next year the same floods come, they have gone back. So I think we need some better way of rethinking so that people do not settle in flood-prone areas. People do not find themselves in situations where they cannot be able to be comfortable when a pandemic breaks out. Stay-at-home orders are also very hard to implement in overcrowded slums. And so beyond this pandemic, we need a master plan that can address housing challenges, especially for slum dwellers, because look at it, it is not possible to enforce these stay-at-home orders in such an environment where crowding is the order of the day, where people live from hand to mouth, and where you cannot even afford to have that room that we are talking about, where you can set aside a room and say, here, you are sick, so we isolate. So you can imagine if you live in a single room, 3 or 4 of you, and you have a situation where one of you is COVID-19 positive, it follows that isolation will not be practical. So how prepared are we when it comes to the next stages? And so as I conclude, I want to say that it is possible to have proper housing for all. It is happening in Rwanda for the IDPs. You can see at some point they were living in tents, but now they are actually having proper houses. And it comes with effective planning. It comes with proper deliberate decisions to know that at one point when a pandemic comes and people have to be protected and people have to ensure that they are not leaving their homes, then surely we need to think about having some standardized way of approaching the housing policies in different countries. I know it's happening in Kenya under the Big Four agenda, where housing is one of the key issues. But the biggest challenge remains that sometimes when these houses are put up, the beneficiaries are not necessarily the very targets, the very people who are targeted by such projects. You end up having the projects ending up in the people who are not necessarily needy as those living in the slums. Thank you very much, ladies and gentlemen, for listening.
Thank you so much, Masibo. Again, there's so much that you have shared that we certainly should engage in conversation about. And so just as you reminded all of us, please do post your experiences and everyone your comments and questions in either the Q&A function or the chat room. Thank you again, Masibo. Continuing along the lines that both Rebecca and Masibo have began our conversation with today, our third speaker, Prince Adu Gyamfi, is a research and teaching associate at the Brian Lamb School of Communication at Purdue University. He represents the next generation of experts from the Global South interested in not only issues pertaining to the Global South, but to all around the world. He specializes in health and risk communication, media effects, and health contexts and communication campaigns. And before beginning his graduate career at Purdue University, he was a public relations expert at the Kumasi Metropolitan Assembly in Ghana, where he helped educate communities on preventing cholera and malaria. It gives me great pleasure to introduce you all to Prince.
All right. Thank you, Stacey, for that wonderful introduction, and I really appreciate that. And I also use this opportunity to thank the organizers for giving me this opportunity to be part of this webinar. And I also thank the audience to be being part of this webinar series. There are many vulnerable communities in Ghana, in Kumasi, Ghana, just like so many parts of the Global South. And the COVID-19 pandemic further increases their vulnerabilities. Therefore, today, I'm here to call us academics, practitioners, policymakers, and everyday citizens to action. People living in slums are most vulnerable during this pandemic, and there are many slum communities in Kumasi. Some notable communities include Aboabo, Aloga, Oforikrum, Aswase, Eijazungu, and I know that many of my Ghanaian fellows who are also part of this are familiar with these places that I've mentioned. And common characteristics of these slums include poor sanitation and lack of toilet facilities, congestions, limited access to potable drinking water, and substandard buildings with poor ventilations. These poor conditions make the people most vulnerable to the pandemic, and the stay-at-home order, which is meant to reduce the spread of the virus, may otherwise increase its spread. For example, In these communities, 73 live in single rooms with 5 persons per room. Just think about the impact this will have on the social distancing protocol and the spread of the virus in general. Some would say there should be a housing policy that is more inclusive. Fortunately, the 2015 Ghana Housing Policy, page 22, states that vulnerable communities and other interest groups should be involved in designing and implementing low-income houses. But how do we do that? Media advocacy is one way we can also include vulnerable people. And I stress, it's one way to indicate that there are other different ways we can include vulnerable people in our housing population. So what is media advocacy and what does it do? Media advocacy is the strategic use of mass media in combination with community organizing to advance a social or political or public policy initiatives. It takes the citizens rather than consumer approach to mass media, meaning that citizens are directly involved in the media content production. It considers citizens as participants in democracy, and it amplifies the volume of local voices for social change. And I have summarized the whole principles and philosophy behind media advocacy as people-centered. And therefore, this people-centered, you cannot find it in any textbook. It's just that I have coined it, and it accurately represent the idea and philosophy behind media advocacy. Now, the question is, how do we make sure that the vulnerable populations are included in our media advocacy effort? And today, I would focus on only 3 things today, and not to suggest that these are the only ways we can include our vulnerable peoples in our media advocacy. There are other ways we can also do that. So the first one I want to focus on is that we use media advocacy in combination with community organizing. This can be done by engaging with highly respected and influential community leaders, such as religious leaders and chiefs. And these leaders are very common in the Ghanaian community, and because they hold so much respect, and they also have that influence. And I know that in your community, there may be different leaders, they can be businessmen. So identify them and work with them. And these leaders will lead in organizing the community people through meetings to get them involved as partners in the overall media advocacy. Here I stress on as partners. If you consider them as partners and your community people also perceive that you recognize them as partners, it gives them that kind of ownership. And mind you that sometimes in cases when you are doing media policy regarding housing, it's a marathon. So you need the organizing, community organizing to sustain your media advocacy. So if you regard them as partners and they also see that they have the ownership, then they can endure with you over the marathon. So it's very good that you regard them as participants, not as audience or maybe as just spectators. And then the second one that is also very important is that provide basic media training for the community leaders and some selected vulnerable people on how to talk in front of camera on radio. This gives the community people the confidence to talk about their problems when approached by the media reporters for interviews. And these are very important that you also do that as well. And finally, work with them, not work for them. I will stress this, work with them, not work for them. Work with the media, with the vulnerable people to frame their housing problems. This can be done by designing themes that raise the local voices. Example can be, we too deserve safe and decent places to live, or the deserted community, whichever theme you come up with that theme. And this will not only make it easier for the people to talk about their problems in a more consistent manner, but it also make it easier for the journalists to tell the story of the community. That is the authentic voices of the community. And these are the 3 ways I think within the time limit, you can also get the vulnerable or community involved in your media advocacy. And there are 2 examples that I would want to share with you where the housing advocates also use media advocacy in their media advocacy effort. And one was in 1999, where a group of housing tenants called the Henry Horner Mothers Guild used media advocacy to pressure the Chicago Housing Authority to repair and improve conditions of their home. They used they successfully used video news release to get news attention. And what they did in that was that they hired a professional news video editing agency to come and do a video about the people, like the tenants who are experiencing, to share their own story, their authentic voice. And then what they did was that after that, they edited it to the format where it is suitable for the journalists. So they just send those videos to there, and it's like reduces the labor that the journalists will go through by editing. They just played it, and it was very successful to get the attention, and they were able to also do that. And the second one was in 2005, where an affordable housing advocate in Oregon successfully used media advocacy to support local investment in affordable houses. They framed their issues within core values, making it easier for media to tell their story. And what they did was that initially what they were doing is that they were just framing their stories on statistics, like, oh, people need housing, or housing, affordable houses. There are people who are living homeless and those kind of things. But immediately they switch to media advocacy. Now they focus their themes or their story, they frame it in their core values, and it makes it easier. And you can see on the screen that, oh, some of the message or the theme they have, what every Oregonian also deserves decent, stable, affordable houses. So these are examples, and time wouldn't allow me to elaborate, go further. I would love to go further. Therefore, I have provided link to these resources for you to also read it, and those who are interested to also read more about how these examples are also do that. And a big lesson to glean from these examples and the literature focusing on media advocacy is that for a media advocacy to be most effective, it should be used as part of a larger advocacy strategy and not the overall strategy itself. I quote, "Media advocacy will not be successful in the long run without the organizational capacity and vision to carry it out. It will not work in the absence of a strong advocacy base." Therefore, I leave you with these two questions as you think about using media advocacy efforts in your housing advocacy. What is the overall goal of your housing advocacy efforts, and what specific role can media advocacy play in achieving your overall advocacy goal? If you're able to satisfactorily answer these questions, then your media advocacy effort is most likely going to be effective. Thank you, and I look forward to your questions. Thank you.
Prince, thank you so very much. You know, throughout the course of these three conversations, these three presentations, I'm reminded of the importance of interdisciplinary work as we think about these issues, and not only interdisciplinarity, but also cross-sectoral and truly global. Together, the three of you have really showcased the importance of this, and it has started to stimulate questions and comments for our audience. So what I'd love to do now is share what some of the comments in the chat room have been and some of the questions, and as we're engaged in this part of the webinar, please do continue to post your comments and your questions in the chat room. So the first question we'll direct to Rebecca, and then Prince and Masibo, if you also have comments on this question, please feel free to jump in. But this comes from Greta Garnis, and she's really posing it to everybody. She first writes, being able to have the legal community enforce new rules, regulations, laws, issues of title is key. She says, I assume it has been extremely challenging to break through some of these cultural barriers. Is the legal community being regularly included in the discussion of housing and land issues throughout the entire process? Or are they only interested in the last part of the process, which is resolving issues of title, ownership, etc.? Rebecca, may we begin with you, and then if others have comments, please chime in.
Thank you, Stacey, and thank you, Greta. That's an excellent question. Yes, it's definitely a challenge, especially breaking some of these traditional norms and practices. But what we know is that it can be done. And also just, kind of referring to, Prince's presentation just now, really trying to identify champions within the community that you can work with. And ideally, if you're able to kind of make, kind of opinion leaders or people who are respected in the community, you're able to work with them and, kind of make them be champions and to be part of this process. I think that would be very helpful. And usually, of course, it is important to have them right from the beginning, not just bringing them towards the end, when issues arise. I think it's important because I think we always say prevention is better than cure, even in terms of coming up with laws, these legal frameworks that address women's land rights. These days, many countries have a kind of they have a requirement that, you need to be able to consult with the communities, you have to engage them in some way. So even in terms of when you're coming up with these laws, the legal framework which will be adopted by, different states, it's important that already you have, different stakeholders and especially the communities, leaders and others being part of this process. And then of course, in terms of the implementation, I think that is really important.
Yes, Masibo, please.
Yeah, I think I want to agree with Rebecca on this, and especially point out that sometimes, again, I think an important aspect as far as that goes is to increase civic education, because there is an extent to which there are some laws that are already in place, but we find that they are being circumvented very easily because maybe women are either not aware of these laws, or two, that the culture seems to override what the law provides. A good example is in Kenya, where the inheritance law has been in place since 1982, and that it requires that both women and men are able to be part of inheritance in terms of the parents' estate. But you will find that for many Kenyan communities, women still do not inherit any land from their parents. It is left to the sons only. Their brothers are the ones who take up the land, and women don't, even when the law actually expressly provides that they have a right to the land. So civic education would be really an important way to go. And of course, then, and this should not just focus on women, but it should focus on both men and women so that they understand the importance of women having to own land.
Wonderful. Masibo, if I might begin the conversation around our next question with you. Larry Bank started a conversation on chat where he wondered what you all thought about the South Africa decision to ban alcohol sales. And he goes on to kind of talk about what's been happening in the United States. Many of the US outbreaks, he writes, seem to be young people partying, right? So in that context, what do you all think about the ban on alcohol sales in South Africa? Enid also reminded us that, if I recall correctly, Enid, that this has happened in the Philippines as well, right? That there's been a ban on alcohol sales. So Masibo, maybe we start with you.
I know that I have seen in the chat room an example of the Nairobi governor who, when he was issuing foodstuffs to families in Nairobi who are locked down, part of his package was alcohol. And he was heavily criticized for having given away alcohol, because I think that was taken to mean that he's encouraging alcoholism and drunkenness and all that. But I think the whole idea of leaving out alcohol is because when people drink, then they tend to become irresponsible, and it becomes very difficult to observe the very reasons that have been set up to prevent the spread of the virus. I know in the US there has been this partying of young people, and the whole question of they come together to compete to see who among them will be the first one to get the coronavirus. And sadly, I think the media reported that one such a case is a young man who 5 days later on had passed on. It all reflects on the very fact that when they say stay at home, there is a reason for that. And staying at home means, I think, people being more responsible. I don't know what Rebecca has got to say.
Yeah, thanks, Masibo. Yeah, I think I think when we look at, the COVID situation that we are going through right now, there's only so much that governments can do, really. But I think there's also us as individuals, what are we doing? Because the government cannot police everybody, because they can, help us with the messaging. Everybody knows what we're supposed to do. But again, like you find in any community, there are always people who always try to somehow kind of circumvent orders, that have been issued. And despite these orders really being for your own benefit. So I think it's really also, we need to also reflect ourselves and really see, are we part of the problem or part of the solution? And I think it's important that everybody works together towards a solution, because we all know, and I think there's been enough education about COVID, where we have been told, social distance, wear masks, wash your hands, and all these things. So, or shelter in place, and so I think it's really, I think it's both ways, really. Of course, the governments, they have a responsibility, but I think even for us as citizens also, we need to be good citizens. Yeah, because then I don't think then these issues around banning alcohol would happen, because then I believe that was done because people were acting irresponsibly to some level.
I'm curious, you had many things that you could have focused on with regard to communication, health, and housing, but you chose media advocacy. Why did you choose media advocacy as something to really call us to action around?
All right, thank you for that question. And I chose media advocacy simply because it's focused on community organizing. Because even in our advocacy, what are you advocating for? And who are the beneficiary of your advocacy effort? So for example, in advocacy, I realized that there are so many communication tools that we can use, but in media advocacy, because it's focused on community organizing such that people who are affected by the problem are involved in the media advocacy, where they are given the opportunity to share their authentic voice. So I realized that the media advocacy gives this opportunity compared to other forms of communication or tools that we can use. So that is basically why, because the idea here is to maybe help the people to be included in the policy. And what are some of the best ways we can include people in the policy? And I realized that media advocacy is one way, because it's focusing on community organizing, and advocacy is also built. The strength of advocacy is based on community organizing, and it's also explaining how we can involve the community in that. And at the end of the day, sometimes I've lived in Ghana, and when NGOs, when they come and then they say that they're advocating, but they neglect the community, they end up, like when you are engaging with the policymakers, they say that who does this problem affect? And we want to hear their voices. We want to hear what really their values concerning this. But sometimes, because they do not involve the community people, so they end up, and then they would end up not achieving anything. So I think that media advocacy, working with the people from the start, involving them, listening to their voices, and every day giving them partnership in that would also help. And that is basically why I decided to focus on media advocacy. And I'm always stressing that it is not the only way. There are other communicative tools that can also be used, but I find media advocacy very relevant in this situation, and it will help to achieve most of the results we want to achieve with our advocacy effort. Thank you.
Thank you, Pran. I have just one final question for each of you. And Rebecca, if we could start with you and then go to Masibo and Prince. I'm wondering what you yourself would like to do next to move forward, and what you would like all of us here today to do to move forward. So I particularly left that question very open, but it's kind of like a call to action, right? What would you like our next step to be?
Yeah, thank you, Stacey. I think, especially with regards to the topic that I was sharing today, I think we do not need to, I think we should not stop. As I indicated earlier, COVID is making us roll back on so many progress that we had made in different areas, in different sectors. And if we don't kind of redouble our efforts around addressing these issues, for example, how do we make sure that we're securing tenure for everyone, not just for particular segments of society? So I think we really need to redouble our efforts, because then there's most likely there will be another pandemic, you know, and are we going to be having the same conversations all the time? So I think we really need to rethink and really see, I think it's really time for action now. Let's do less talking, but let's do more to address, because I think these issues have been at the forefront for years, you know, and now we are seeing, you know, they've really been laid open due to COVID. So I think it's really time for all to act and address, you know, the housing deficit that we are having, the inadequacy of housing that we are having, you know, this insecurity of tenure. You know, we really have to address. We have to provide basic services for people. You cannot tell people to wash their hands and we don't have water, for example, you know, and things like that. So I think we really need to improve our living conditions. We need to invest in housing. I think that's more important more than ever at this point.
Thank you, Rebecca. Ms. Sibo.
Right. I think for me, I want to take it that housing is really key, given that we have seen homes are an important part of defense when it comes to a pandemic. We must ensure that everyone at least has a house. So going forward, probably the starting point is one, just like I pointed out, the differences between the North and the Global South. We need to document housing needs in different contexts and demonstrate the various projects that are already underway and prove that this kind of projects can be done so that we can have a rallying call. I still go back to what I said, the fact that access to housing, a proper house, should be considered a human right. I think it's unacceptable, and even at this point in time, to find people who are homeless, to find it is even worse when you imagine that we have refugee camps and you can see people staying in some little plastic things in the name of a roof over their heads. This is a very common thing whenever we have war and we have refugees moving from one place to another country, it becomes a problem. So all these things call for very proactive planning. And I think at this point in time, the Global Build Network, together with UN Habitat and all the other stakeholders involved in this, we should be able to push the agenda to see to it that we are able to have some standard housing, such as the case we have seen in Rwanda, so that people, and then also we must start thinking, when we know that this particular place has a problem, like I said, why should we continue building in places where buildings should never be in the first place?
So thank you. And Prince.
All right, thank you all. We've all, thank you for your time. And the discussion also have demonstrated that housing is really very important, and it becomes very important in times of crisis like the pandemic. And one thing that I, as a communication person, sometimes that people may have that misconception that they think that communication can help you solve your problems. What I want us to take away from it is that when you have a problem like a housing policy, you ask yourself, what is your overall goal? Like your advocacy effort, what is the overall goal? What do you seek to achieve? And then you ask yourself, what specific role can communication play? So if you're able to answer that, oh, this is the specific role that communication can play, then it will help you to also choose the appropriate communication tool that can help you to also do that. So as a communication, somebody who likes communication, one thing is that always ask yourself, what is the overall goal of your advocacy effort, or maybe whatever goal advocacy that you have, and ask yourself what specific role that communication can also play. Because sometimes communication may not be the answer. Sometimes communication may play just a part of that. So by answering these questions, you'll also be helping yourself, also getting people also involved in your advocacy effort. So that will be my takeaway, and then that will be the takeaway for everybody. Thank you.
Thank you, Prince. And now I'm delighted to turn it back over to Esther Obonyo from Penn State with some closing remarks.
All right, thank you. Thank you to all the speakers and also Stacey and the moderators, and a big thank you to the participants. I will take a couple of minutes. I hope you'll hang in there. If you must leave at 9 o'clock sharp, I say thank you. Please join us again, keep in touch, we will email you. But I wanted to just take a couple of minutes to close the loop, because we started off saying that there are some very good ideas. There are some case study projects, pilot projects. We have a lot of technologies at the research stage of the equation. And the challenge we're having as people who are working in the building sector is how to move them out into the real world. They're falling into the valley of death. And some of the things that came out for me
we seem to be having some tech issue. Esther, I think you're breaking.
Actually, we have lost her. I can't hear her at all.
Yeah.
Ceci?
Okay, well, I apologize for the technical difficulties that we are having with Esther. I think if she were able to speak, she would be reminding us of the work that we have to do and that we should.
Stacy, it's
Yeah.
Robin Tate here. What we will do, what I will do is that I'll have Esther re-record her closing remarks, and then I'll edit it and add it to this webinar session.
That sounds fantastic, because I know Esther has been really, with Rebecca's really been spearheading the effort to continue moving forward this series of webinars into both research and practice areas and engagement. And I know she had spent some time thinking about how she wanted to motivate us all to move forward on that, and to remind us that it really does take a multi-sector, multi-disciplinary, multinational effort to do so, and cross-generational. You know, I will just say that it's been such a pleasure to work with Esther, Rebecca, Masibo, Enid, Anjali on this webinar, and thank our three speakers today, Prince, Rebecca, and Masibo, for their enlightening remarks and their calls to action. We will record Esther's closing remarks, and hopefully you will have a chance to hear those and allow them to continue to motivate all of us as we move forward on this journey together. All right, again, Prince, Rebecca, Masibo, thank you so much for your comments, and thank you all for being with us for our third webinar in this series. Good day, everybody.
Thank you.